Midlifers, welcome to Let's Talk Midlife. I'm the Midlife Maven, your host, Natasha Hardy of Hardy Life, because you deserve a Hardy life. This is a podcast for midlife women who want to learn tips, tools, and strategies to get through their second season of life. Have you ever struggled with poor self-care, lack of confidence, having no plan, and the fear of aging? Well, you're in the right place. Press play and let's dive into today's episode. Happy midlife to you. Happy midlife. Welcome to Let's Talk Midlife. And we have our amazing guest here, Malika Moore. And Malika is going to tell us about herself and what she does as a care manager. So Malika, introduce yourself.
Hello, I am so happy to be here. This is an honor to be on your podcast. I know you have some of the greatest speakers, so I'm adding myself to the list.
Yes.
I'm Malika Moore. I'm the founder of a company called Aging and Amazing. And Aging and Amazing does a few things. Like Natasha mentioned, we do have care management. And what that means is basically, as an aging life care professional, I coordinate everything for a loved one, whether they're trying to move out of their home, stay in their home, or a family caregiver or older adult just doesn't know what to do. So we come in, all these scattered puzzle pieces. We put each of those puzzle pieces together with the right resources. Occasionally, there are missing puzzle pieces, and we do our best at replicating those. We also have our Aging and Amazing signature online community. It's an online community for anyone pro-aging, family caregivers, and any professional that works with older adults and family caregivers in any kind of way. We do webinars and training and consultancy. So a whole lot of things going on with Aging and Amazing, but our motto is we're all aging and amazing.
Absolutely. Thank you for that.
You're welcome. Thank you.
When I think about care management, right? And you said it consists of a number of things.
Yeah.
Tell me, what kind of support or resources do you provide and for whom? Because you spoke about the aging family member or person, and you also talk about the caretaker. So who do you provide resources and or support to?
That's a great question. So we are capturing everybody, everybody in that system. So it could be the older adult themselves that need support, and we're helping them figure everything out. Maybe they're trying to relocate, or there may be a situation where they're at end of life and we're helping coordinate things then. Or it just may, I get calls where people are being that's not a lot of my calls, but I get a lot of calls where people are being very proactive and planning, saying, hey, I think I'm going to need this in a year or so, or I'm currently caring for my spouse or my aunt or my cousin. And then a lot of children call from out of state who are caring. We have the sandwich generation, those caring for raising their children and caring for a loved one or a parent. So to answer your question, the support is to whoever calls us. We help them. Sometimes I'll get calls that say, hey, well, my mom or my aunt doesn't think she needs help, but she needs your help. So a lot of times I'll be working as an ally with the family caregiver to say, okay, they may not be ready for me to come in, but let me work with you, and here are some things that we can do. So in a sense, kind of coaching them and giving them the appropriate resources and referrals. I say that we are wonderful brokers of resources, because a lot of what makes my job great is knowing who to send people to for what they need if it's not something that I can do directly with my license as a social worker or as an aging life care professional.
That's amazing, because I was listening to a show you were on recently, and the interviewer was asking you a number of questions. And one of the things he was saying is that his organization doesn't take people to the doctor and sit in at the doctor and take notes, and asked if you did that. And you said, yes, we do. We provide going with the person to the doctor and taking information notes so that information is disseminated amongst the family or the necessary parties to know what exactly gets to be done. And I thought that was pretty interesting. And then what I thought was interesting is the gentleman said, do you fill pill boxes? And you was like, no, I would lose my license, but
Right.
I have a care provider, a licensed professional to do that. So it was, when I was listening to the interview, it was so interesting because it was, you were really almost like a oh like orchestra, conducting the orchestra, and it's like you did your part, and then what you couldn't do, you had the violins do and the drums do, and you know, you're basically conducting activities for people to do that you can't do in
Right.
your organization. And I thought that was pretty amazing.
Right. I love your analogy. That is a perfect analogy. We do go above and beyond, but you know how they say, stay in your lane. We definitely try to stay in our lane. And if we have to blur it a little bit that won't compromise our license, then we try to immediately get the right professional in there that can help.
Yes. And I know that I'm an occupational therapy assistant, and I do know what you were speaking about when you talked about the caretaker and speaking with the caretaker and kind of coaching and directing the caretaker when the person isn't willing to or is in denial about the kind of support they need, right?
Right.
And I remember when I worked in the nursing home, a lot of the issues with the patients is there was denial about where they were. And a lot of the training I had in school was how to be able to work with people who were in denial or who were resistant to care. And if they don't have care, how could you get, if they refuse your care, how can you get them to get the care that they need? And it's very interesting at that stage of the game, because here you are working with an adult who's a senior, and they may also be incapable of caring for themselves. So there's a level of losing the independence and feeling like I don't have my autonomy anymore. And it is a
Right.
way to really work through that. And it wasn't until I worked in the nursing homes that I understood why we had to take so many psychology classes, right? We had to take about 3 psychology classes, and I couldn't understand why are we taking abnormal psych, and it's definitely necessary. Okay.
I want to comment on that. You're first of all, you're a woman of many talents because you have all this skill set that you can offer in addition to everything you're doing now. So that kudos to you. And I agree with you wholeheartedly. I worked in the nursing homes. I still go into the nursing homes as a consultant. And I think it's a great training ground. Like you said, it's so much going on when people are there, from depression to grappling with family dynamics and trauma and just everything that can impede getting help. I know a couple of years ago, I was in the hospital briefly sick, and they wouldn't let me get out of the bed. And when I tell you, it gave me some empathy that you just can't have going in a room saying, oh, no, it's okay. You just stay there. You know, it really felt like I was stripped of who I was. And it probably was only for a couple of days, but I'm like, no, I can get out of this bed. I know I can do it. And so when you think of it that way, just this kind of discrepancy and of who you were and where you are at that moment. And for some people, they're not rebounding and getting back to the level of care they were before they went into the nursing facility as hard as we try.
Yeah. Yeah. And it's not only the person in the bed or the person that's being cared for, the quote unquote patient, right? It's also the family members. Some of them are in denial, and some of them have a hard time seeing the deterioration of their loved ones and before their eyes, and it makes it very difficult for them to say, oh, this is my mom or dad as I know them, as I knew them, and I don't want to see all of that. So there's a lot happening in this space. That's why I said when after I got into the nursing home environment, I was like, oh, I understand now why we took all those psychology classes.
It's necessary. Sure. It's necessary for sure. I mean, even for the workers, it's so much going on in healthcare and so needed. So yeah, kudos to all the healthcare workers out there and family caregivers and older adults, everybody. Like we talked about before, Natasha, it's really having a whole team to get what you need. And sometimes we don't know what we need, and we have to be able to at least access the right person to get us there.
Yes. Now, what's important in this conversation to me today for midlifers to know, and you spoke into some of this, midlifers themselves, there's a planning process that needs to be in place for them as they age. There also is a planning process that gets to be put in place for their parents. And one of the things that I speak about, and it was in a January show I did, was having a midlife plan. And why was it so important to have a midlife plan? Because most of the time, society does not prepare us for all the changes we go through during midlife and afterwards. And what is it that we get to have in place on top of the retirement? We're talking about being able to manage your finances, your living conditions, like you said, relocate. My friend's mom is moving down to Georgia with her, and her mother is only a couple of years older than me, but that's what they've decided to do. So her mom is relocating. And I also had a friend who took care of her aging aunt who was blind, and she stepped into caregiving for her, but didn't really have a background in it. So
right.
Two questions I want to ask you. One, I'll start out here, is when is the best time to prepare or start planning for assistance for a care manager?
I will say the time is now. The time is now. And that's, like I mentioned a little bit earlier, I said most of my calls, people are in crisis. They're not planning ahead because everything's fine. And I just want to preface this because we're all human. We're talking about progression, not perfection, because there's so many things going on in our lives. There's no possible way that we can plan and prepare for every single thing that's going to happen. And I mean, I think if you've been living any amount of years, sometimes you can have plans and they go the complete opposite of what you expected. So I would say the time is now to call a care manager, especially if you have older parents, or just if you're single. Get the information so you can kind of get ahead. Like, okay, who do I need as my power players as things start to progress? Because I'll never forget my client who said one day she was my age and the next day she was 98. So sometimes we think we have more time to plan than we do. So my friends laugh at me, but I always say, okay, when I get a house, I want an elevator in it. Like an elevator. You don't need an elevator. I'm like, I'm just thinking ahead because of the work that I do. And I see people not able to get to other levels of their home. So just thinking about, okay, like your friend you mentioned, will my parent or my loved one need to relocate? Do I need to help them find another place? What kind of health issues are they having now that I'm seeing now that down the line could be problematic. Home care is a big one. You know, if you don't meet certain income requirements, you may be paying out of pocket. If there was no long-term care insurance and or the policy didn't cover it. So home care, thinking about the home that they're living in now, are you going to be the primary caretaker? You know, sometimes it's going to be me that's going to have to step up and do XYZ, especially if you're an only child. But if you know you're this busy mover and shaker, okay, you need a care manager. Like, look, this is the plan. Maybe you can start introducing the idea to your loved one while they have capacity. They're able to talk about these things and say, you know what, I do think a care manager is a good idea. Let's budget for this. We don't know how to budget for it. The care manager will be sending you to a financial planner or someone to talk insurance. Then if they're having trouble just with this, grappling with all of this, oh, maybe we need to send them to a midlife coach or someone to help them get through that other piece while I work through this piece. So anything related to aging. So we're talking housing, we're talking medical care, just even knowing the right questions. If you've just gotten a diagnosis, what do I do now? Like what are the next steps? What specialists do I need to see? Just coordinating everything. So I think for the most part, really viewing somebody helping you as a strength and not a weakness. So just getting a care manager can help you put a plan in place. Okay, what do we have now? And what are some common things that older adults and family caregivers face? And how can we be proactive in some of these things so that when it comes, we have somewhat of a plan and we can get the right players in place, because it's game time. So we already have the plan there. It's game time. We may have to do some adjustment, move some people in and out. Maybe we have to relocate to a different state, but the players are still the same. We just need to get them in the other state. So I hope this is making sense, but the time is definitely now, as early as you can. But don't be dismayed if you haven't. Just start now. Just call and get information or find out what resources are available.
What came up for me when you was having this conversation is I'm 60 and I live by myself.
Mm-hmm.
And one of my biggest concerns is I'm living by myself. And before my granddaughter came to live with me, I used to think I'm living by myself. How would anybody know if something happened to me? Right. And I'm here in the house by myself? If I choke on something, if I slip or fall or what have you. Right. And so my listening is, it's care manager. A care manager isn't only for you if you're 80 or 90 or if you're ailing. What you're saying is once you hit midlife, once you hit 40, you need to start thinking about what this might look like for you, because the truth be told, you don't even know. Like when I worked in OT, I've seen people in their 40s with a stroke. You know,
absolutely, yeah.
What kind of ailment's going to come? You don't know. And then just even my concern about what can I put in place? Yes, it has me thinking now. What can I put in place? I might need to talk to a care manager. What can I put in place to make sure that my safety, or that I'm here in my home by myself? What can I put in place that someone knows that I am okay? Because I had a conversation with my nieces and my nephew around my birthday. And I told them, I said, I'm 60 now. Y'all need to call me and check on me regularly. Stop waiting for me to call you. Initiate calling me. And you know, one or two of them took it personally, like I was scolding them. And I was like, I'm just trying to let you know that this is a reality. It's not. And so even young people today, their perspective about engaging with seniors or with older people is, oh, she's high functioning, she's fine. And that's not the case. It's not. You don't just assume just because someone is high functioning that they're fine. because you still need to check on them. Anything could happen. Anything could happen at any given moment. God forbid, knock on wood that it hasn't, and that I am high functioning. And on the flip side, I have a client, which I interviewed last week. She's 89.
I love it.
And she's a storyteller. She swims. She's very busy. I can barely keep up with her. She's so busy. I have to book her out. I train her twice a week. And let me tell you, recently, she, every so many years, she says, my body is changing. My body is changing. And I used to say, you're fine. You're just this. And so I realized that what I'm doing is dismissing her reality, whether she's changing or not, right? If she feels like she is, that's her perspective. It's her truth. And so I said, just honor her when she says that, because it's not fair to make it like it's not real. And so what we did, because she says, I'm not remembering everything, I paired my project manager with her. And so the project manager has started working with her, and she was like, her stuff is all, we were talking about her stuff is all over the place. And the project manager is now like pulling in all the stuff, because she had this person doing this person doing that, this person doing the other. Now she wants a home taker, she wants a home care attendant. She wants a home attendant. She has somebody cooking vegetables for her. She has somebody this. And so it's like she's all over the place. And what we discuss is this idea of the project manager being the one that oversees everything and being able to bring it in. So the project manager is handling, so conducting, like I said earlier, conducting and pointing to her who she should have doing things, so that she's not having a lot of people and money spread out, right? So if you get a home attendant, the home attendant can clean your house and cook your food. So you don't need somebody to cook your food and clean your house, and you have a home attendant. So it's like we're talking to her about bringing it in, and like, instead of having 5 people do 5 different things, the project manager is like, I can do those 5 things. So it's like, and then because she's noticing there's difference in her functioning, right? Then she has less things on her brain. And she said, she told me, she said, I went to bed feeling so much better because I didn't have all these things on my mind, because we implemented, because I suggested the project manager for her. And so I'm saying all of that to say to people is that getting support doesn't necessarily mean you are helpless. It's just supporting, streamlining, making things easier for you in this season. And that season may change from 1 month to 1 week to 1 year. So yeah.
Mm-hmm. Yeah, you said a few things that I wanted to comment. And sometimes, for that last statement you made, sometimes I know I had a friend of mine, I have to get some things done in my own life. And so I said, yeah, I really need to get some help with this. But I was like, I don't want to talk about it. And she was like, Malika, go ahead and let your pride get in the way. Because she was like, this seems like something so simple. It's just you're embarrassed to talk about it. And I'm like, yeah, it is my pride. So sometimes it can be pride, sometimes it's finances, most definitely, and sometimes it's just not knowing where to go. So identifying like, what's the barrier, what's stopping me from getting to whatever resource I need or don't know I need. Then you mentioned about the solo agers. So that's a huge thing. I know I attended a workshop recently, and they were mentioning about, children kind of being the backup plan. That's not always the backup plan, even if you have children or nieces and nephews. So that's where care managers work closely with attorneys. Sometimes you'll have people, if they're a solo ager, get an attorney to manage the legal financial portion, and the attorney will work alongside a care manager in saying, okay, you make sure Natasha's okay. Like, you make sure you get everything. If you didn't have capacity, you get everything done for her. If you do have capacity, talk to her about what she needs and get it done. So sometimes you may plan for people to be there, but they may not be able to because of things that are happening in their own life. They may not want to. Let's not even get into, sometimes people don't have good relationships, and it's something that they just don't want to do at all. And so care managers are helpful for that type of thing. And the last thing I wanted to say is, I love how you highlight dismissing. It's easy to do, especially when you see someone so strong and just doing so many things. But we do know when something's off with us. And so I really like how you use the phrase honoring, like, the change that people are seeing instead of dismissing it, because sometimes it could seem like, okay, that's an easy fix, but it could be daunting. And that's sometimes what prevents people in getting the help that they need, whether it's the caregiver or the older adult.
Yeah, I really feel like that was key to me, because I remember when I was going through menopause, and when I was, people would see me one moment and then the next minute they blink their eyes and I had all this sweat pouring off of me. And they was like, "Are you okay?" And, when I worked in the clinic, they were like, "Let me get the heart rate monitor."
Mm-hmm. Yeah.
And then when I was around friends, they would go, "What is wrong with you?" And I was like, "I'm in menopause." And it would be like, "You're not in menopause. You're too young for that." And it would just like be a total dismiss. Meanwhile, it's like I'm going through this, and it's difficult for me to process what's happening to me, because at the time, nobody was really talking about menopause. Like, menopause is more in the foreground now than it was when I was going through menopause.
Mm-hmm.
So then it doesn't help me even monitor myself, because there's that like, maybe I'm not going through that, just it gets that kind of like, well, then what is going on? And
Yeah.
so that's one of the reasons why I felt like it was important to honor what she was saying, because I remembered how I felt like dismissed and not heard and valued what I was saying, because I was saying something to someone that made them feel uncomfortable about aging, right? It was like, "Oh, if you're going through menopause, that means I'll be, and that means I'm old." And it hasn't nothing, one has nothing to do with the other. But it's so very,
Right.
very interesting that we got to always be in a space where we honor what people are saying. And that's one of the reasons why with my client, I said, "Hey, let's get you a program manager. Let's get you a project manager,"
Right.
which was the person I was working with. And I felt like could work with her. She's living at home with her dad. She's very familiar with whatever. She has a background in the medical field. She's kind of like very familiar. So I felt like if anybody's going to work with her with ease, it would be um my project manager.
Okay.
So here's an interesting question. I'm not sure if we touched on this or not. What advice would you have for family members who are caretaking for aging adults?
What? Okay, that's a great question. That is a great. What advice would I have? Breathe. Breathe, because one of the things you're going to get is a lot of advice. You're going to get a lot of people telling you you should do this, you could do this, or don't say this, or don't feel this way, or so the first thing to do is just breathe, because it's going to be a journey. It's going to be some highs and some lows, and some people have more lows than highs, and vice versa. You're going to create your journey. One thing, as you were speaking, Natasha, I thought about how, even with this podcast, how speaking openly just helps us sometimes heal and know the right direction to go. Like if we felt more comfortable being open about our vulnerabilities and our failures, and look, I did it all wrong. And that's how we learn. That's how we know, oh, there's a care manager, or there's a midlife coach, or I should go see the neurologist, or I should go do this, or I should go see a financial planner. If we felt more comfortable saying, look, this is too much. I love my mom, I love my aunt, I love my cousin, but this is beyond. Like I'm feeling resentful, I'm feeling mad, I'm feeling angry, or being honest, finding you support. So one is breathe and get support. Do not go on it alone. Like I said, I probably say this in every single interview I do. I am great with other people's families. But I have my own family, and trust me, I need help. There, every family has something. And I work with a lot of people who are embarrassed, saying, no, 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 you haven't met any family like mine, or this or that. Listen, every family has some drama. And I can confidently say that. They may not admit it. They may put a bow on it or whatever, or some money on top of it, or some makeup. I don't know. But every family has something. You have to get a support system. You have to have some people, maybe a support group or a person that you can talk to and say, look, I didn't envision my midlife being caring totally for my loved one. I'm supposed to be dating, or I'm supposed to be traveling, or I'm supposed to be doing this and that. I can't leave the house. Like I'm resentful. I love this person, but I'm resentful. Or you know what? This is a great joy. Let me help somebody who's struggling with it. So really having breathing and having community, get all the resources you can. Get all the resources you can, and have positive people in your life who are going to know, like, look, I know you're like this today. You're frustrated. I haven't seen you like this, but look, I know who you are. I know what you've done. I know who you are up under all of this stress, and you need help. So let's find you a care manager, or let's call the Department of Aging. Let's get you a coach. Let's connect you to an online community. Just start somewhere. Reach out and wave the red flag.
Yeah, I think that's beautiful. You said that so beautifully, because so many things were going through my brain when you said all of that, because it's true. Every family has its drama. And at the same time, people are embarrassed to ask for support, and they feel like they could manage it or have it. And I think I was sharing with you, like my aunt passed away in November, and my aunt has a big house in upstate New York and with her husband, and my aunt has 6 kids, and they also have a house down in Florida that they would go and stay at in the winter months. However, my aunt has 6 kids, and all her kids are working. They all work, and some of them are retired from their regular job, but they are still working part-time or whatever. So when my aunt was sick for months, they were kind of rotating for 6 months or so to do this. But now my aunt is deceased, right, dead, and she and my uncle is there, and he needs support. And so I was talking to my cousin who's in the medical field, and I was like, she's like, we were going to get somebody for mama, but she transitioned. I said, yeah, but you need somebody for your father.
Right. You need a care manager. A care man, they're everywhere. So you can.
I don't think people don't even know that this is an option. I think the point is what you're saying is people don't know having a care manager. People, please hear this. It's called a care manager to manage your loved ones or yourself, right? I'm going to look into this for myself. Right. And when you said take care of your loved ones, so for me, it was me taking care of my granddaughter who was supposed to be here for a year and has stayed, right? And I felt angry. I felt resentful. I felt like I didn't have any friends. My whole social life was all the things I was doing, traveling and all that stuff was now like a thing of the past. And I felt like my life was disappearing in front of my eyes. And it was through a couple of my friends, but coaching with one of them who said, let's find her a place to be, your granddaughter to be where, you know, she's going to have all the support, because I'm single and there's not a lot of family support or support, right, that comes into somebody that can actually step in and take. I think people don't understand there's a difference between somebody coming in and saying, oh, I'm gonna do this once a week or once a month or every once in a while. Is very different than someone who's saying, I'm coming in and I'm going to handle this piece and then that's off my plate. They don't understand that. I'm going to give you a break for a day. No, I've had this child for 4 or 5 years. I need a break for months on end. Like I need a break, you know, it's like a couple of months break. And people don't get it. So what you're saying, what I'm hearing you say is, even people who are taking care of people, they have the same experience that I had with my granddaughter. And times I felt like I was whining and crying and complaining so much that people just felt like, can you just just relax? I mean, it's just get with it. But that was a scenario, and I'm sure this happens to people. That was a scenario that I stepped in to do for 1 year, and it just went longer than that. And my granddaughter had so many needs that I had to even learn how to handle what her special needs were and get her tested and all that stuff. So it's just like all these things that I knew nothing about. And what happened is it began to exacerbate for me. And I kept feeling like I was drowning, like I was failing her. I was failing at it. I was failing her parents, everything. I would be so angry, and I was so swamped. I never knew what to, how to describe what was coming up for me. But now that she hasn't been here for 5 months and is in boarding school, I can kind of unpack what was happening. And because I was over 50, I should have had a care manager, because I didn't know that, because I couldn't get any help. No one was willing to help me. It was like you either had to live in the Bronx to get that program or here. And it was just like, I just, after a while, just gave up on getting help. And the reason why I'm emphasizing this and speaking into this is because I feel like this is aligned with people who step into taking care of their parents or their senior loved one.
Yeah, I've ran a lot of caregiver support groups, and I've had been in close connection. I can hear the caregivers listening to your podcast saying, yeah, that sounds very familiar. So yeah, even though you're doing it, you may be doing it out of love and you care for that person. It's a shift. You have to learn, you have to integrate this into your life. And caregivers, I've work with caregivers who thought it would be a year, and year turned to 20. They've been caregiving since their 30s, and now they have children, or they put off having their own children because they may have had older parents or whatever the case may be. So not to make people feel like a burden, because the tables turn and we all may need support and help, but saying, look, the feelings that you're feeling are normal, like the tiredness, the frustration, the resentment. Yeah, that's your mom, and you're tired and you're frustrated. Yeah, that's your dad. And so really, really asking for help. I had a perfect example. I had a caregiver, a young caregiver, because a lot of times when we think caregiver, we're thinking somebody older. I work with caregivers who are in their 20s, 30s, 40s. Like this is touching all of us, right? And I had this caregiver in their 20s that just didn't ask for help. But when I got involved and she asked for help, when her church came out the woodworks with support, and I was even in awe at how involved, and they just didn't know. So sometimes it's just raising your voice to the right person who can get you and say, hey, look, they knew of the care manager, or we can do this part of this journey for you. So don't try to be Superman, Superwoman, whatever you would like to use. Really get some help. And sometimes we don't know we need help. So it takes somebody saying, hey, whoo, you're not yourself. Like you're snappy, you're looking tired. You've been to the doctor. A lot of caregivers, I'll have them tell me, I went to the doctor and the doctor put caregiver stress on my chart. And I'm like, yeah, a lot of times the caregiver passes away before the person who's receiving the care.
Yeah.
Then what? You know? So did you plan that out? Like that's something we would be planning. What if something happens to you? Who's going to make sure everything's okay for the loved one? But how can we prevent something happening to you by you trying to work your full-time job, be there at your other commitments, and figure out the healthcare system and all that's available to you out there. When somebody like me, that's my full-time job. That's what I do. So take that off your plate so you can breathe a little bit.
And that you've been trained in. And that's what I think a lot of people miss. That they feel like, oh, this is my father or my mother, and I should be able to do it. And I said, you can't. You haven't been trained to manage a senior person. And I can say that because when I got a degree in occupational therapy. We worked in geriatrics. There was a whole training on working with people that of a certain age. And it's a whole skill set on memory and tons of things on ADLs and IADLs that I never even knew anything about those things before I went to school. So imagine someone who just said, oh, this is my parent and I should be able to do that. And you're not even trained. You don't even know what it takes. You just think it's just managing them. No, it's a skill that people are trained in and paid to do.
Exactly. And like I've said more than once, there are even some things I can't do. So I'm trained in knowing, okay, we need to, she's saying that, she's noticing something with her memory. Let's get her to the neurologist. Let's request a complete medical workup just to see. Maybe nothing wrong. Maybe it's stress. Maybe it's depression. But these are the steps. These are the professionals that we need to get you to kind of look into this further. And it's since I've been doing it for so long, it's kind of second nature, like, oh, boom, 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 do this, do this, do this. And I can see the person's face on the other end like a relief, like, okay, I need to do this. Because sometimes I have caregivers that call me and say, look, I just need the plan. I'll execute the plan if you can just tell me what to do. And then you have others who are like, look, I can't do anything. It may be because they don't want to or they just don't have the time or the energy to do it because they're running full-time businesses, or they're living the life they wanted to live and they want to make sure their loved ones taken care of also. So how do I still execute that without neglecting anyone? So there are options out there, just knowing the options.
Yeah. And
thank
you for sharing that. That was so rich in what you just shared. And I never even aligned what I was doing with my granddaughter to
definitely caregiver.
What people be experiencing taking care of older adults. I just and people just they don't get it. And when I say people don't get it, it's people who you're asking for help from. Some of them don't get it. They don't want to do it. Like you said, they're oblivious to all that's involved. They're in denial. Right. You got those factors. And then you got the whole other side where they feel like, oh, well, why don't you just get on a call and have everybody get on a call and let everybody know what's going on. And everybody will kumbaya come together. And you just need this strategy. And it's like, no, if you ask somebody for 3 years to help you with something and they don't help you, I had to tell my friend the other week, I was like, what do you tell somebody with 2 black eyes? Nothing. You've been told twice. If they're telling you 2-3 years, no, or I'll get back to you and don't get back to you, that means that's a no. You got to read, you can read the signs, right? The nonverbal communication.
Right. That's true. And then it's like the adage, you want quality over quantity. So you can have many, many voices. You need the right voice in your head, because that can lead you astray. Sometimes people can be doing a great job and have this critic who's not there at all, saying you should be doing this, you should be doing that for this one, or do this, but they have no clue. Or if you hire a care manager, why'd you hire that person? We could have did X, Y, Z, and the other, but you didn't.
Yeah.
So it's just having the right voice in your ear, because you'll have so many. And really, sometimes you have that sound voice that's really trying to help you and they just don't know how. And then you have the voices where it's like, look, I heard about this support group. Call there, or call the Department of Aging. Just start there. Or this lady at my church is a nurse and works with seniors. Start with kind of some people who are solid, if you don't know where to go, that are going to talk about it to people, but talk about it because they're geared towards a solution rather than just the next conversation.
Yeah, it's interesting, right? Once again, you know what you do. So when people are telling you stuff, it's being dismissive to what you know your reality to be, right? You know your reality to be. I've had a lot of people, don't send her to boarding school, don't this, don't that. But I'm like, but you ain't knocking on this door to pick up any weight. But you don't want me to send her to boarding school. Like, I got to do what's best for me at this juncture, right?
I want to comment on that, because I know we're not talking about the boarding school, but we are, but it reminds me of nursing homes. Mm-hmm. So sometimes I will meet with families, and sometimes it's families of color, and it's this tremendous guilt about putting their loved one in a nursing home, because we don't put our loved ones in nursing homes, right? It's not the right thing to do. But then when I sit down and I talk with the family, they're at work, then they got soccer practice, ballet. Mm-hmm. They have like their days are 14 to 20-hour days, and this loved one needs 24-hour care. And let's talk about this. So what's the best solution? Is the best solution not to put them in a nursing home and leave them at home neglected for 20 plus hours?
By themselves alone.
Right. Or do we want to put them in a maybe the nursing home is the best solution, and I'm having conversations about the guilt, of course, because no one's in their 20s and 30s talking about, oh, I can't wait till I turn 60, 70 so I can go to that nursing home. Right. No one's saying that. These are things that happen. So when I'm talking to families, I'm saying, okay, what can we do to make sure like this is the best experience they have in a nursing home? And if it's not, we know all the people to call to like ring the alarm if it's not happening. So I talk to them about strategies such as having someone show up, like let them know that Miss Jones' family is popping up. Like or the care manager for Miss Jones is coming. We don't know what time or hour. And if anything's out of place, she's going to have something to say. So moving from, oh, I had to put them in a nursing home, and say, look, let's talk about it. Like you mentioned, the boarding school. Who was helping you before you put her in a nursing home? But everybody's upset now that you put her in the nursing home. But I'm watching you, Tina, and you're going there to check on her. You're following up with the staff. You hired a care manager to pop up to make sure they're doing what they need to do. And I always tell people, it doesn't have to be a 5-star nursing home. I don't care where they are, because everything that glitter isn't gold. You want to send somebody in to check, to pop in, to make sure that things are happening and your loved ones being cared for the way you want them to be cared for. And another myth is that if you you have to place your loved one in a nursing home or assisted living or somewhere like that you're no longer a caregiver. I've had people sit in my support groups and say, well, I had to put my husband in a nursing home. I don't know if I'm still a caregiver. Absolutely, you are. Like that didn't, because your granddaughter went off to boarding school, you're still a grandmother. You're still checking up and following. In fact, you may be busier trying to make sure everything's going smoothly. So a lot of times it's challenging those beliefs that we grew up with. It's taking a real hard look at your schedule. Like, can I really do this and not leave the person neglected? Where now we have adult protective services coming in here because I wanted to keep a promise. Like, was the promise worth what the outcome is? You know? So just really reframing things, but because occasionally we can't keep those lifelong promises that we have, because we talked about earlier, sometimes we plan, but things don't go the way that we plan. So what do we need to do now? So think about what's at the core. You want your loved one to have a good quality of life. Is a good quality of life them being home by themselves and they need 24 hours? That's not a good quality of life. So what can I put in place if I can't afford privately to pay for aides to come in 24 hours? What's the next best step? And how can I navigate this to make sure that it's still working for you and your family, and let the other people talk who weren't helping in the first place?
Yeah. And I'm glad you're saying this, because now I need to talk to the project manager to work with my client to get a case manager, a care manager for her. And I think that that's what she needs at this juncture, because it would help her to see if she qualifies for A, B through Z. And that is such a valid point. This wraps up part 1 of the care management episode. To hear part 2, kindly listen to the next episode. Thank you for listening in today. You could have been anywhere and you chose to be here, and for that, I truly thank you. Remember to like, subscribe, and leave a review at the end of this podcast. Follow me on Instagram and TikTok at Hardee Life. That's HARDEE Life. Also, you can catch me on LinkedIn under my name, Natasha Hardee. Remember, if nobody's told you that they love you today, let me be the first to say, I love you, and there ain't nothing you can do about it. Go be amazing, because you are. Because you are. Until next time.